Hi Alice.
Hi Sven.
Today I want to talk about the patient care of MS patients, and we want to discuss frequently asked questions. And this is why I want to start with the immune pathophysiology of MS. So how do you explain to your patients what MS is and what symptoms they are facing and what relapse might be?
Yeah, so I tend to first describe what MS is as a disease. So when patients have this diagnosis, obviously you want to understand why this has affected you and why not someone else, because you're healthy, you do exercise, these are young people who have otherwise had normal lives, and that's the first question, why me? And it's a complex question, and we're not quite there in the field of MS research. We're not at a point where we can answer it directly, but we know that genetic plays a huge role, so your genetic makeup, your environment, which viruses have infected you in the past, especially Epstein-Barr virus, and how your programmed immune system, that's a part of your genetic makeup, responds to these viruses. These are all really important factors for the MS. But basically, what happens in MS is that your immune system attacks your brain and attacks your spinal cord. And this is a mistake, and it shouldn't happen in a healthy body. And it's complex why this happens, but we know that your immune system should have mechanisms in place to avoid then this attacking of the own body. And those are then not quite right in patients with MS. And what happens is that you have nerve cells that have a body and they have long legs or long fibers and a sheath around the fibers. And just like a wire that needs insulation, your nerve wires also need their insulatory sheath. And this sheath gets damaged and attacked in MS. And your immune system, the cells there, attack the sheath and break it down. And that's what happens in a relapse, is that the immune cells come into the brain or the spinal cord and at one moment attack this sheath, and then you have a relapse, or you have your first presentation of MS. And what we do is we give cortisone, so we give prednisolone, methylprednisolone, and we can also do plasmapheresis to dampen the immune system to stop it from attacking the nervous sheath.
In a given relapse?
In a relapse situation, yeah exactly. At that moment in time where this attack is taking place, and then the patients get better. Sometimes they also get better without therapy because the immune system, we don't know exactly why, but it then stops, and then the sheath can rebuild itself. The nerve itself, if it's too damaged or if it's left without the sheath for a long time, it can't rebuild itself. So it's always important to go to hospital and get that checked out if you have a relapse, so that we can start with treatment early. And over a long period of time, to prevent these relapses, we give our treatments. And you can kind of understand a relapse as a fire. And we can extinguish this fire with prednisolone and with plasmapheresis. But we can't extinguish what's left behind in the coals of the fire.
So like the smouldering part of the disease.
The smouldering part of the disease, thank you.
Yeah.
Exactly. And that's the part of MS that causes progression over long periods of time. So you have two aspects of MS, these acute relapses, which are very well treatable and good to treat with our long-term therapies, and you have this smouldering, not quite burning inflammation that is very difficult to treat actually, because these immune cells have come into the brain and they're over a long period of time somewhere where they don't belong, causing slow damage.
And can you talk about the symptoms patients are facing, especially in the early phase of the disease?
Yeah, so the classic presentation is a young woman who, because MS tends to affect women, who sees blurrily out of one eye, and it's sort of like a milky fog, and classically also then colours that are like red become more grey, and that's an inflammation of the nerve that is behind the eye and goes to the brain and controls vision. Also common would be tingling or numbness in an arm that goes on for many days, and then can also then get better or stay there. And then a couple months later, maybe tingling in the leg, weakness of the foot, stays for many days and maybe goes away, or maybe there's a bit of tingling that never really goes away. Also important to not forget is our symptoms like feeling that you need to go to the bathroom often because you're not quite in control of your bladder. These are also aspects of MS that are important not to forget, and also symptoms of a relapse.
So sometimes when I awake in the morning, I also feel maybe tickling, numbness in a finger or in a hand. Yeah. So do we have a definition for an MS relapse?
We tend to say to our patients, or one tends to say more than 24 hours. So if you're a right side sleeper and you're sleeping on your right arm and you've pressed your nerve all night and you wake up and it tingles, me too. That's okay.
Okay,
then
good to know.
Good to know, yeah. Then that goes away within 20 minutes, maximum an hour maybe. But if that's present for the whole day, and then the next day it's still there and maybe it's a little bit worse, and then even the day after that it's still there and it's not going away after a week, then go to the hospital, in Germany anyway, or go to your healthcare provider, because that would be more suspicious for a problem that won't just go away with time.